An astronaut suffers a massive heart attack 250 miles above Earth. There's no helicopter, no hospital. The nearest emergency room is 6 months away. What do you do? NASA didn't just hope this wouldn't happen. They built the infrastructure to save lives in the most hostile operating environment ever created. Today, we're exploring the reality of surgery in microgravity, real ISS medical emergencies, and how NASA is preparing for the impossible, performing emergency surgery on a 7-month Mars mission with zero evacuation. Can you perform surgery in microgravity? The fundamental problem. Surgery on Earth. Blood pools downward, instruments stay in place, fluids behave predictably. In microgravity, everything collapses. Blood forms floating spheres. An incision releases a cloud of droplets obscuring the field. Instruments float away. The patient drifts. What actually happened in space? In 1993, NASA performed the only surgery ever done in actual space. Spinal cord surgery on a rat aboard Space Shuttle Columbia. Results were sobering. Bleeding control proved extremely difficult. Blood formed suspended droplets. Tissue visualization degraded significantly compared to Earth controls. The 2-minute procedure was successful, but extended surgeries, greater than 15 minutes, showed substantially higher complication rates. Parabolic flight simulations. NASA uses parabolic aircraft, generating 20 to 30 seconds of weightlessness to test surgery in microgravity. Suturing accuracy decreased 20 to 30%. IV placement success dropped from 95% to 60%. Hemostasis, bleeding control, required 2 to 3 times longer than Earth procedures. Current verdict. Basic procedures lasting less than 30 minutes are theoretically possible. Laceration repair, pneumothorax decompression, IV access, basic fracture stabilization, complex multi-hour surgeries, beyond current capability with substantially elevated complication rates. Evacuation reality, Soyuz return. Any life-threatening ISS emergency requires evacuation via Soyuz, capable of returning crew to Earth in 3.5 hours. However, return involves 4 to 5 G deceleration forces a critically ill patient may not tolerate. Myocardial infarction or intracranial hemorrhage patients might not survive re-entry forces. Timing depends on orbital mechanics, fastest return at specific windows. ISS Medical Kit, CHECS. 500-plus medications, surgical supplies, diagnostic equipment, designed for stabilization only, not definitive surgery. Surgical procedures, possible in space. High feasibility procedures. 1. Needle decompression for pneumothorax, collapsed lung. 2 minutes, high success in parabolic tests. 2. Emergency airway, cricothyrotomy, 2 to 3 minutes, anatomically straightforward. 3. Laceration repair, limited complexity, minimal bleeding, moderate feasibility. IV access, 60% success rate in microgravity versus 95% on Earth. Minor fracture stabilization, very low feasibility. Abdominal wound, exploration, 15 to 30 minutes, requires anesthesia, hemostasis, nearly impossible in microgravity. Tissue visualization through floating blood, limb amputation, very high difficulty. Controlling hemorrhage from large vessels in weightlessness remains unsolved. Specialized equipment NASA developed. Hemostatic devices, electrocautery modified for microgravity. Closed-loop suction/irrigation systems capturing floating blood. Patient restraint systems maintaining position during procedure. Instrument containment trays with electrostatic barriers. Mars mission preparation, the Mars problem. 6 to 9-month transit. Communication delay 3 to 24 minutes. Light speed. Zero evacuation capability. Crew physician must be self-reliant. NASA's strategy. Crew training. 200-plus hours surgical training. Full emergency medicine equivalent. 100-plus hours advanced ultrasound. Medical kit. 1,000-plus medications versus 500 on ISS. expanded surgical instruments, diagnostic equipment, AI support, AI decision-making systems, 1,000 plus pre-planned medical scenarios, telemedicine, crew selection, aggressive health screening, no cardiac disease, VO2 max greater than 50 milliliters per kilogram per minute, psychological evaluation for accepting mortality risk, artificial gravity, rotating sections generating 0.3 to 0.7 g, simplify blood management, and preserve muscle mass. The hard truth. What we don't know. No human has undergone surgery in space. Optimal anesthesia for microgravity unknown. Long-term outcomes of space surgery untested. Emergency surgical capability for complex procedures remains theoretical. The reality. Prevention is the primary strategy, but prevention always fails eventually. One unexpected medical emergency could kill a crew member millions of miles from Earth. NASA trains surgeon astronauts for that moment. Mars crews are explicitly prepared to accept that death from untreatable medical emergency is possible. Surgery in space isn't science fiction. It's science reality NASA is preparing for. From the impossible physics of bleeding control in microgravity, to real ISS emergencies, to theoretical surgeries that might save a life on Mars. The truth: humans weren't designed for space, but NASA is engineering solutions. When an astronaut launches, their crewmate isn't just a specialist. They're a surgeon ready for the worst-case scenario millions of miles from home.